Hi, my name is Tom Dolphin. I'm the Vice Chair of the UK Junior Doctors Committee. This week we're going to be looking at the rights that you have around your education and training. You're in a junior doctor training post, and that means that everything you do is focused on your training so that you can improve the care that you give to your patients. Locally, the quality of your training is managed by clinical tutors and other people within your employer. And on top of that, there are structures within deaneries and at a national level that are there to make sure that the training that you get is of the highest quality. And we're going to be looking at ways that you can make sure that that quality standard is met. Before you even take up a post, there are ways of finding out whether the quality of training in that post are any good. Obviously, you can try and find out who's in the post at the moment and ask their opinion of the training that's going on, but there are slightly more structured ways of doing it as well. The BMA runs an annual survey of trainees, and that is going on in springtime, and the results of that are published in April or so. The results of that are broken down by post. You can actually look and see for each specialty within a given employer what the trainees that are in the post think of the post, how they rate the standard of supervision, how they rate the teaching they get, how they rate the library and all that sort of thing. And you can use those results from the survey. You can go to your training program director or your foundation school director and say, I've heard about this post and I understand that I'm supposed to be going there, but the training isn't very good, and this is the result from the BMA trainee survey. That's one example of a way that you can make sure that the post that you go to is of the highest quality. If the training program director is receiving lots of trainees coming to them saying, I don't want to go to Hospital X because it's dreadful and the training is awful, then they're likely to investigate that, and the training there will hopefully improve. And it also means that you don't have to go to a training post that's not going to be any good. If you're already in a post and it's turning out to not be very good and the training substandard, or you're being poorly supervised, then there are various ways that you can do something about this. Normally people would start at a local level, and then if they're not getting satisfaction, they would escalate their complaint up the system. So normally you would start with your local educational supervisor, which would be your consultant or your GP trainer, and if they're unable to help you or you don't feel you can approach them, then within each local education provider, which is a hospital or a GP training practice, there will be somebody whose responsibility is the education of all the trainees within that employer. And you can go to that person, you can tell them what the problem is, and they should be able to sort it out. If they can't, you can escalate it further. Your deanery or your foundation school will have people that direct your program, training program directors, foundation school directors, whose role it is to supervise the training and make sure that it meets the standards. You can approach them and tell them your concerns and say that you've been unable to get satisfaction locally, and they should be able to help you by intervening in some way. The aim is to try and keep the complaint at the lowest level possible so that things can be resolved with ease and locally, so that the solutions match what needs to be done. If you're still not getting anywhere despite having involved your deanery or your foundation school, then you can contact PMET, which is the Postgraduate Board of Medical Education and Training. And they have national responsibility for approving training posts across the whole of the UK. You can approach them directly. They do recommend that you try the local processes first, but the PMET website, which is www.pmetb.org.uk, has a list of contact points on there where you can approach them directly and let them know that your trust or employer, health board, GP training practice, wherever, are not able to train you up to the standards. Quite often, the problems around education and training revolve around rotas and working patterns. Sometimes it can be quite difficult to get to the training opportunities that you want to because the rota has you continually off after nights or having days off in order to bring your hours down. And this can lead to people not being able to access the training they need. Sorting this out on your own can be quite intimidating. So if you talk to your colleagues, you'll probably find that they're having problems with the rota as well. And you can then approach the rota writer collectively so that you can help them design the rota in a way that means that you can all have opportunities to get the training that you need and take it in turns if necessary. If the rota does get changed, there is a rebanding protocol that needs to be followed, and part of that involves it being signed off by someone responsible for your education and training to make sure that the rota does fit with the need that you have to get the education and training necessary to complete your post and get the competencies you need signed off. An important provision of the junior doctor's contract is the study leave allowance. This is time that you're allowed away from your normal workplace to attend courses and specific targeted training, teaching sessions. This is a very important part of the contract, but people don't often take it up as much as they should do. Foundation Year 1 doctors, unfortunately, don't have study leave allowance specifically for courses because their entire time at work is supposed to be spent in learning and supervised training. However, you will find that your foundation school will have allowed for your generic professional training time, of which there are around 15 to 30 days a year, depending on the foundation school. They will allow for that to include such things as the Advanced Life Support course. And if they don't, you need to speak to your foundation school director and point out that you need to do these courses. They're a requirement for all sorts of different reasons, and they should be able to accommodate that relatively easily. Doctors in F2 and above, including SPRs and STRs and people in FTSDAs, are all entitled to 30 days of study leave in the year, and that can be taken at various times. Some rotas have fixed leave with study leave, but that's something you need to negotiate with your rota designer locally. All of these things are very important. People should take their study leave. People often don't, but it's an important provision that's been built into the contract, and we strongly recommend that you look for opportunities to use your study leave. This is only a short video, so I've not been able to go into much detail about the issues around education and training and your rights within the contract. Your post is there for you to train, and it's very important that you make full use of all the rights available to you. For BMA members, there are full resources available on the BMA website.